Okay, so in my case study, we're dealing with ulcer disease. My patient's name is Maria Rodriguez. She's a 38-year-old Hispanic female. She speaks Spanish and English. She's Catholic. She does use tobacco. She lives with her two daughters that are 12 and 14. She works as a computer programmer Monday through Friday, 9 a.m. to 5 p.m. Her grandmother had diabetes, and her father and grandfather had peptic ulcer disease. Maria was diagnosed with GERD 11 months ago. Some indications of GERD is impaired swallowing, which is dysphagia, aspirations of gastric contents into the lungs, and ulcerations. Maria experienced some symptoms of hematemesis, vomiting, and diarrhea that led her to get some GI workup. So eventually she ended up having a gastroduodenostomy to treat her duodenal ulcers that they found, and they also found gastritis with a positive biopsy of H. pylori. In the case study, we were given her typical diet recall. So her typical diet, breakfast consisted of 1 slice dry toast, but on the weekends she ended up eating a little bit more. So she would eat an omelet or rice, pancakes, waffles, and fruit. Her typical lunch was a sandwich from home, turkey, wheat bread, and mustard, with fruit and then 2 or 3 Chips Ahoy cookies. Her dinner was 2 cups of rice, 2 to 3 ounces of any type of meat, 1 cup of fresh vegetables, usually tomatoes, peppers, or onions. Her beverage intake consisted of 8 to 10 cups of coffee and 1 to 2 soft drinks daily. So her and her two daughters self-prepare and purchase the food at home. Maria has no known food allergies or intolerances. She doesn't take any vitamins or mineral supplements. Once she was admitted to the hospital, she was NPO and she was receiving Pivot 1.5 continuous drip. And based on the case study, you could tell that she was very eager to get back into solid foods. So she was 5'2", she was 62 inches, her weight was 110, and her BMI was 20.2, which was a healthy weight. Okay, so as you can see, my patient does have a good range of abnormal labs. On the left, you do see, a good bit of highs and lows of labs, but it was nothing too crazy because, she did have a diagnosis that gave her symptoms like nausea, diarrhea, and vomiting of blood, which you're gonna see some sort of malabsorption symptoms. So for instance, like her protein is low in the beginning because of her H. pylori, and with that, you're gonna that causes stomach acid to inhibit proper digestion of proteins. And then like her glucose was high on September 2nd because of her tube feeding. And then you'll see on the right side, it's more of her CBC count. And that as well is abnormal highs and lows because she did she underwent a lot of bleeding from her ulcers and from her hematemesis. Okay, so based on her physical exam, the only abnormal ones that stood out was her skin. It said that her skin was warm and dry to touch, and this could be because she had a temperature of 99 degrees, and it could be dry because the amount of coffee she drinks. She could be really dehydrated. She could be dehydrated because of her hematemesis too, and she showed rapid breath sounds, and this could be resulted from the duodenal ulcers. And she also showed that her abdomen was tender with guarding because they are inflamed organs within the abdomen, and she hasn't shown any, she hasn't passed any stool yet. She has absent bowel sounds, and I think this is why the doctors said she's almost ready for solid foods. Okay, and I have 3 PES statements. My first one is increased nutrient needs related to altered GI function as evidenced by diagnosis of PUD, altered nutrition-related lab values, duodenal ulcers, hematemesis, and liquid stools. Her altered nutrition-related lab values, like her low total protein, her high white blood count cells, her high direct bilirubin, and her low albumin. And all of these things can cause the patient to result in weight loss or nutrient-impaired oral intake. So it's important to increase nutrient needs based on her weight status. The second PS statement is inadequate calorie protein intake related to GERD symptoms of dysphagia as evidenced by patient adhering to weight loss in last couple weeks leading up to admit date during counseling interview. And this one is just, I put this because the patient admitted to having difficulty swallowing during the interview session that we had, which she admitted to eating less building up to her visit in the hospital. And my last one was food and nutrition related knowledge deficit related to lack of education or understanding of the details of caffeine restriction for an ulcer disease patient as evidenced by interview and her daily diary intake. The patient admitted that it was normal for her to drink this much and that she didn't know it was a huge symptom of ulcer disease, but that she was willing to change. Okay, and so for her nutrition interventions, I put continue NPO until physician releases patient to solid foods. And then because she's nauseated, I put 8 hours with no vomiting, start oral intake slowly by adding one solid food at a time. And then it's recommended that she'll eat smaller, more frequent meals to tolerate better. Avoid foods high in fat or fiber, as well as foods that have a strong odor. And there's really no data indicating that the diet is a causative factor for PUD. It's mostly based on like restricting foods that will cause irritation to the gastric mucosa. So foods to avoid when you have ulcer disease is black and red pepper, caffeine, coffee, alcohol, milk and cream because they increase gastrin and pepsin. And then restricting acidic foods is only recommended if the individual cannot tolerate them. Foods that are recommended is non-cola carbonated beverages, herbals, teas, skim milk, 1%, buttermilk, low-fat yogurt, poached, hard-cooked, or scrambled eggs, all ready-to-eat cereals, baked, roasted, broiled, grilled, stewed meats, low-fat cottage cheese, peanut butter, all except fried potatoes, rice, and pasta, all fruits and vegetables, fat tolerated within current dietary guidelines, and all except high fat or fried desserts, and all except pepper. Okay, so for my nutrition intervention plan, I put my patient is able to maintain or regain optimal weight status. So based on the food journal that I told my patient I will give to her, I just want to see if she's experiencing symptoms that may cause any weight loss again, or if she's doing well with her current weight. And then the next one is patient is able to show improved food choices by next visit. Again, based on her journal that I'll give her, I just want to see if she's eating foods that are recommended for ulcer disease. And my last one is patient is able to see normal sounds of bowel movements. I just want to see if she's experiencing any signs of diarrhea again. Okay, so I'll see my patient in 4 weeks. And with the help of that journal, it'll help me evaluate what kind of foods that she needs to increase or decrease. And it'll also help me see what kind of, if she's experiencing any more symptoms of PUD. And then I'll just monitor her weight, see if she's good where she's at or if she needs to gain weight. And that's it.